Health authorities in Delta State say about 22 persons have died from an unidentified disease that has, in weeks, ravaged the communities of Ute-Obu and Idumesa in Ika, Northeast Local Government Area. Commissioner for Health, Dr. Mordi Ononye, says medical officials from his ministry, along with representatives of the World Health Organization, WHO, visited the communities to collect samples of necessary clinical tests. All right, for more on this, let's cross live now to Asaba, the Delta State capital, south of Nigeria, where Dr. Mordi Ononye, Commissioner for Health, Delta State, joins us live. Glad to have you, Dr. Mordi. When did you first notice this disease? Because according to the latest figures, it has consumed about 30 lives. Couldn't this have been prevented if the state acted swiftly to contain it?
We were first informed on Friday the 30th of October of mysterious deaths going on in the community. Unfortunately, the inhabitants of the said communities initially did not bring forth these reports of deaths in the communities because maybe they thought there were other reasons for these deaths.
And I would have to ask, at a time when we're experiencing COVID-19 pandemic, do any of these deaths have anything to do, are they related to COVID-19 in any way?
Well, for the samples we've collected from patients we encountered, none is COVID positive. So for us, even though COVID was amongst what we suspected, but of course the lab results showed it is not COVID.
All right. What more do we know about this disease aside the fact that the disease is linked to hemorrhagic fever or substance abuse, interestingly? And what substance abuse are we talking about here?
We were first informed because of the age bracket involved, mostly persons between age 15 and 25. We considered substance abuse. But of course, from what we now know, it is not substance abuse.
Okay.
Second part of your question?
Sorry, he didn't particularly finish it off there. I talked about linking it to hemorrhagic fever, not just. It wasn't just substance abuse, but you've knocked out that one. But what about?
Yeah, we thought of substance abuse and also one or the other of any of the viral hemorrhagic fevers.
So
Lassa fever, yellow fever. These were part of the differentials we had on our mind.
And just to clarify, are you saying we still do not understand what exactly is killing people in those communities?
Now, samples have been taken over time as we went about doing active case search in the various communities. And from the sample set, we have a presumptive diagnosis of yellow fever. Some of the tests came out positive for yellow fever. We are waiting for confirmatory results from the National Reference Laboratory and the WHO Regional Lab in Dakar.
Is it contagious, doctor? And if it is, how is your government making sure that it does not spread to other communities?
Yes, at the receipt of the information, His Excellency the Governor directed immediate response to see to it that the outbreak, whatever it is properly and effectively contained. And so teams from the State Primary Health Care Development Agency, the World Health Organization, NCDC, the National Primary Health Care Development Agency, and the State's Emergency Operation Committee are mobilized and are working actively in the identified LGAs. We've been able to identify 8 main wards in the LGA that is mostly affected, and we've begun heavy risk communication activities to sensitize the community, create awareness. We're doing vector control as much as possible, and we're planning on a reactive vaccination in that in the said LGAs.
Well, Commissioner, you talked about the age demographic that this has affected, but can you tell us anything about the gender involved? And very quickly, let me ask you about the coronavirus pandemic, because according to the NCDC, you have not reported any case in the last 5 days. Are you saying the pandemic is over in your state?
No, we're not saying the pandemic is over in Delta states, but we're saying that we have been able to effectively flatten the curve and get the curve also on a downward swing. I think the measures we did put up to as our response, to the COVID-19 have been very, very, very effective. That most of the samples we run, you don't get any positive cases, and so right now we're doing well COVID-wise, and I hope to remain so.
All right, we'll leave it there for now. Dr. Mordi Ononye, Commissioner of Health, Delta State. Thank you for being on the program. All right.